Good evening. My name is Selena Joffrey, and I'm the Director of Business and Policy at Asia Society Texas Center. Thank you for joining us for week 12 and the final program of our COVID-19 series. This evening's webcast is on the topic of how universities are preparing for the age of coronavirus and beyond. Tonight's discussion will be on the decision-making process for colleges and universities on reopening, what the campuses may look like this fall, and the long-term effects of the changes we're seeing in universities as they adapt to the pandemic. Our speaker this evening is David Lebron, who has served as Rice University's president since 2004. Prior to joining Rice University, he served as the Dean of Columbia Law School. President Lebron, we are very grateful to have you with us this evening. Our moderator is Laura Eisensee. She covers education for Houston Public Media, including K through 12 and higher education. Following the conversation, we'll be taking some questions, so please share your questions throughout the discussion via the Facebook and YouTube comment box. Thank you.
Great. Thank you for that welcome, Selena. And thank you, President Lebron, for joining us this evening. I'm really excited to hear more of what higher education is looking like in the near term and the long term. But before we get into that, it's been about 3 months since Rice University and other colleges in Texas and around the country sent students home to learn remotely. Can you catch us up on what the new normal is at Rice and paint us a picture of what the fall semester might look like?
So the new normal right now and over these months have been a largely empty campus. We had about 10% of our students living on the campus and about 10% of our staff coming onto the campus. We moved our entire summer school program online, which actually resulted in a tremendously increased enrollment for us, both here in Houston and around the country and around the world. I think as we look forward to the fall, we're still expecting and hoping that we can reopen the campus with our students in residence and most or many of the classes taught in person. But it's a complicated process in which we really have to assess the situation at each step along the way. But right now, we're expecting to open in the fall, and we'll assess that right through probably the middle of July and make a final decision around then.
So as you're making those plans, and obviously there's so many unknowns still with this coronavirus pandemic, can you give us a sense of how you're making those decisions? What kind of framework is guiding you?
So we started off with 4 basic principles that guide us throughout this. First and foremost is the health and safety of our community, which is, of course, students, faculty, staff, and others who might come on our campus. And while we're doing that, also, we hope to make a contribution to the health and safety of the larger Houston, Texas national community by keeping people safe and preventing the spread of the disease. Second is to make our decisions based on the best scientific guidance available and scientific principles. And that means really, first and foremost, the Center for Disease Control. And third is carrying out our mission as best we can under those circumstances. And finally, doing everything we do in accordance with Rice University's values, which are responsibility, integrity, community, and excellence. And so those are the 4 basic principles. And then as we've thought about the fall and this uncertain and changing circumstance, we've really been guided by 3 basic ideas within a framework. And they are to be flexible, agile, and adaptable. And that really led to our decision to provide in all courses where it was possible what we call dual delivery, to plan to deliver the courses both on campus and online simultaneously. and to be able to move very quickly if we had to change again and be all in line. That's the agility part of it, that we can make very fast and quick decisions. And adaptable in terms of not all people in the population are the same, and we have to be able to adapt in some ways to their particular needs.
Yeah. I want to go back to one thing that you mentioned, which is the science. Can you tell us more about that? What kind of data are you tracking? What kind of public health and scientific factors you're considering as you make concrete plans towards the future?
Yeah, so we track a large number of sites and look at the developing science and expertise, papers that are published. We're fortunate to have an epidemiologist on our team. And we're fortunate, really fortunate, to be across the street from the Texas Medical Center that I want to come back to. But the overriding guidance really is the Centers for Disease Control. What is their guidance? What are they recommending? But we get a lot of information, and we really put together not only an internal team, but an external committee with folks from the Texas Medical Center. And I really could not say enough good about the Texas Medical Center, its leadership under Bill McKeon, and then each of the institutions in the Texas Medical Center. In particular for us, that's been Baylor College of Medicine and MD Anderson, Methodist Hospital. And so they have really provided us with a lot of guidance and expertise as well. So we put all that together, and then we look around our own guidance. What's the guidance being provided by the mayor, for example, or the county judge or the governor? And we put all that together, but the overriding factor is the scientific evidence, the Centers for Disease Control, and making sure we're aware of the latest sort of knowledge about COVID-19 as we make our plans.
So let's get a little bit more into those plans for the fall. I'm sure it's on the minds of a lot of students and faculty and parents as well. And one thing I'm curious about is universities like Rice, residential universities, they play such a huge role in student life and public life beyond the classroom, often providing resources and activities. How much did that factor into your decision to bring students back on campus as you're envisioning it right now?
So again, the first and foremost is the health and safety, and we know the student population is less vulnerable than other parts of our population, but we have to be concerned about potential spread of the disease. But we also know we had a very successful online experience in the spring, but we also know from our students they yearn to be back on campus and have that fuller experience and sense of a community, whether that's extracurricular activities or, for example, parts of the education that are difficult to replicate online, such as laboratory experience. Of course, for our music students or our architecture students or engineering students working on design projects, it's hard to replicate that online. But I think people have to remember that the college experience, the undergraduate experience, is about much more than just sitting in classes. And it's a time of our students' lives. They chose the university, not just because of the faculty or even the buildings, but because of the community that they will be part of. And so when we need to, we'll do our best to replicate that community online. But we know that that whole experience of being with their classmates, of being in this incredibly diverse environment of just extraordinary young people, that's really very important to them. And so that was certainly a part of the decision making, was being able to carry out our mission, as I said, excuse me, in the very best possible way.
On the health side, there are some real concerns about the challenges and the spread of disease as campuses open up in the fall. You know, and particularly with enforcing social distancing in places like dorms and classrooms and other places on campus. How are you dealing with those? What are you doing to address those health challenges?
Well, I think first and foremost is to really develop a set of clear and relatively simple policies. As I point to our values, our third in the list is the value of community. And I think it's important to communicate how important these rules are for the safety of the community, make them visible, I think it's likely we'll ask our students, for example, to sign a pledge when they come back to abide by the rules. I think the two most important parts of that pledge are wearing a mask is required on the campus, and particularly in buildings, and social distancing. And it's not going to be exactly the same in all spaces, but I think getting students and others to understand the central role that these practices play. We'll put a testing protocol in place. We'll have arrangements in place where we need them for quarantining and isolation if we need them. And so we're sort of in this process of developing a complete set of plans, as universities all across the country are. But I think with the students, the important thing is to understand why the rules are important and understand what the rules are, and to not be unreasonable about what we're trying to do with the rules either.
So when you explain the rules and have students sign a pledge, how confident are you that young people will follow them, especially when so many of us want a sense of normalcy?
I think that's going to be a challenge. It's not going to be normal back on campuses across the country, even those campuses that are open. There are going to be rules, and we have lots of rules on our campus, and we have mechanisms for enforcing the rules on our campus. And so we're also in the process of developing what are the right mechanisms for enforcing these rules and making sure everybody understands this is a community responsibility. We all owe this responsibility to each other to protect ourselves and protect our community. And that I can't say often enough here, that means wear, and this isn't just for our students, this is for everybody. Wear a mask when you're out in public, and keep your social distance and be careful. None of these are perfect, but it's not about perfection or eliminating all risk. It's about reducing the risk to acceptable levels. And I think our students are very smart. And as long as we, I think, effectively communicate with them, and we don't try to have rules that can't be justified, I think we'll find, as in other areas, what we found in the spring was just the remarkable spirit of community and willingness. And I think when the students say, okay, I want to be back on campus, but in order for that to be a safe experience, these are the things that I need to do. I think we'll find that the students, by and large, are going to adhere to those rules.
Yeah. Thinking about the community at Rice and other colleges, there are members of the campus community, students, faculty, and staff who may have a compromised immune system or live with someone who's vulnerable or or are at risk for COVID-19 in other ways. And how do you plan on accommodating them if they're not able to be on campus or, otherwise?
So that was one of the reasons we chose dual delivery. And so if a professor is immunocompromised, or even has somebody in his or her family who's immunocompromised, they may not feel comfortable being in a classroom, and they'll be able to deliver that class remotely. The students may be sitting in the classroom or not sitting in the classroom. And so the same thing is with students. And a student might say, I don't feel comfortable coming to campus, but I want to continue my education. That student will be able to do so. Or a student may say, I'm comfortable coming to the campus and being part of my residential college, but I'm not comfortable going to a classroom and sitting in the classroom with a lot of folks because of my immune situation. And again, that student would be able to take that class online. And that's the adaptable part of the flexible, agile, and adaptable, that it's adaptable to each of those individual circumstances. And so we built that into our approach from the very beginning.
So a lot of adaptability for the classroom. Let's step outside the classroom and talk about all the other different kinds of events that happen on a college campus like Rice. Sports, music concerts, conferences. Are those going to come back in the fall in some form or fashion? Or do you imagine them being delayed for the foreseeable future and those kinds of things being online, if at all?
So I think some will come back. I mean, right now we're putting a limit of 50 on gatherings, and so that's going to be a challenge in certain areas, particularly intercollegiate athletics is going to be a challenge, and we're in the process of reviewing how exactly we'll go about that. A concert, instead of having a few hundred people, may have 50 in a large auditorium, and we have a unbelievable new opera hall opening up in the fall, and we had planned a large gala, but if our rules are still in place as they are now, which is 50, then it'll be 50 people there if we do it that way. And I think what you'll see is more of these will be looking for the equivalent of dual delivery in effect, right? So maybe 50 people be able to be in the concert hall, and maybe you do the concert more often, but then you also stream the concert or stream an athletic a game, for example. So I think we're going to have to, again, continue to be fairly flexible. But right now, the rule that we intend to have in place is no gatherings of more than 50. And we'll have to think about how does that rule apply to outside events? Is that a different rule? And how do we get people to maintain the distance at outside? The evidence that we know suggests this disease spreads much less outside, but that doesn't mean that you shouldn't also be wearing a mask, also keeping some distance in order to prevent those from turning into the hot spots for the university or the city.
Yeah. So for students who are planning to come back in the fall, or maybe freshmen coming to campus for the fall semester for the first time, they may be very eager, but also nervous, or even scared. What's your advice for them and also their families? How do you think students can really get the most out of university life with all these safety measures in place?
So I've been thinking a lot about that because in some ways it's the central question, and a little bit of the analogy. I don't know how good an analogy it is. Uh, it's like driving in a thunderstorm or a snowstorm. I had to do that this past weekend, and it's going to be different, right? It's going to be, you have to drive more carefully. You have to maybe drive slowly. Maybe there's some roads that you can't go on as you're driving in those circumstances, but you can get from here to there. And I think, when our students come back, we're going to have safety first and foremost in our thinking. And they're going to have to think about they're driving through a storm. This is a global pandemic. That's the equivalent of a global health storm. And they're going to have to navigate that in a slightly different way. And as with an automobile in a storm, not a hurricane, but maybe a thunderstorm or a snowstorm, you're going to have to navigate that carefully. And what does carefully mean? You're going to have to wear your mask. I'm sorry if I'm going to say that about 30 times. You're going to have to wear your mask, and you're going to have to keep your social distance. That doesn't mean you're not going to have a core group of friends. And we see that in people's behavior around and families. You may have a core group of friends that you remain very close to and part of the community, a small number of folks. But other than that, you want to navigate this very carefully and make very good decisions about your behaviors. And then we know that that works. And I think we're well set up to do that at the university, really, is to accommodate all of that, as I've said, enable people to make very careful decisions. But they are going to have to navigate this a little bit differently than they would have under the usual circumstances. But they will be able, I think, to get a tremendous amount out of that experience because the community will be present.
Mhm. What about international students? They play a really important part of U.S. universities, from their tuition dollars, and also the cross-cultural exchange and bringing their talents to campus. With the travel restrictions and visa denials, border closures, and this whole shutdown that we've seen, what does the future look like for international students at Rice? And on the flip side, for study abroad, for students at Rice to travel to other universities?
Yeah. So we are an extraordinarily international community. Around 11 to 12% of our undergraduates are international. I think about 40% of our graduate students. And even though the issues don't quite affect them in the same way, by some measures, more than a third of our faculty is international. That is, they got their first degree in higher education overseas and then came to the United States. And just an incredibly important aspect of our community, higher education in general, and I would say the United States. And so for a lot of our students, the students who are continuing, many of those students did not go back over the summer to their home countries, and they should be able to return without a problem to the university. And I think for our entering students, I think that is a concern we have. Are they going to be able to get their visas in time, all all the consulates and embassies going to be open, and will some of the same standards and processes apply? And so we'll support them in whatever way we can. We've made it very clear we welcome these students to our campus. They are a just vital part of our community. We have indicated somewhat greater flexibility. And so, for example, we haven't in the past taken very many students mid-year, but I think this coming year, if a student doesn't get his or her visa in time for the fall and wants to come in the middle of the year, we'll be flexible about that. Or if an international student wants to defer for a year because they can't necessarily get here in time, we'll be flexible about that. And so we're going to be reaching out to our international students and make sure they know how much we want to welcome them to Rice. And again, I think for this coming year, we're hoping it's a limited number of students that will affect, but we're going to do everything we can to help those students participate beginning in the fall at Rice University.
So again, a lot of flexibility as we deal with a lot of unknowns and how things can change very quickly. We have just a couple more questions from my end here, and then we'll be taking audience questions. So feel free. We welcome your questions for President David Lebron. But before we go to audience questions, I do have a couple more. And one is finances. We're in a recession now, thanks to COVID-19, and the pandemic has hit a lot of colleges hard financially, as some have even announced furloughs or layoffs. How do you expect university finances to be impacted long term? And how do you see universities adapting to these financial challenges?
So I think there are a lot of kind of issues to deal with. I do think all of our revenue sources are under some pressure, not just Rice, but the endowments are down across the country. I think student need is going to be up, and we'll have to respond to the student need. There may be students who defer, for example, and don't arrive immediately in the fall. Of course, a lot of our donors are affected as well, as their investments have suffered as a result of the decline in the financial markets, for example. Unemployment is up. All of these things are going to affect universities. I think Rice is particularly in a fortunate position for a number of reasons. Over this spring, we certainly have prioritized not only the delivery of our services, but also keeping our staff fully employed, even when they weren't able to come to campus and do work. And that'll certainly be a priority going forward, is to try to really, to the extent we can protect our staff, keep folks employed and deliver the services. But we all are going to have to operate within our financial means. This is going to put a lot of pressure on universities to become more efficient. And so that may be some good that comes out of this. We're going to be looking very carefully at how we're structured and organized, what the administrative structures are, and save costs where we can save costs reasonably. And so I think that's really going to be happening widely across the country. I think some universities are probably going to be discontinuing programs that they have, or maybe research centers that they have. We don't immediately see that at Rice. And so we're able fairly well, we think, to weather this storm, but it is a storm. And I think it has aspects of the sort of Great Recession of 2008, 2009. But I think what makes it more challenging is the potential that we can't operate as we usually operate, and the students may not be able to get to campus, for example, or we may not have to be online again. It's not our plan, as I said, but I think all of those are going to put great pressure on higher education across the country.
Yeah. Kind of bringing those different threads together, you have, the financial challenges, you have changes to operations, potentially going back online again. When you look out to the future, what do you see are the long-term implications of this pandemic on higher education as we know it? What parts of this new normal do you think are here to stay? I think of remote learning, or dorms, or no more entrance exams like the SAT, flexible schedules. And what parts of this new normal do you think will fade as the virus fades?
So that's a great question, and I think again I think some positives that will come out of this. I think we are as institutions becoming much more flexible about how we think about the delivery of our services, about who can participate and take advantage of the education we offer if we're doing a lot of things online. And so you have many more institutions thinking about offering more online. Rice was in a good position because we were already significant participants in online education. We have 2 online degree programs, and so we could move quickly online, but we're going to continue a process of expanding our online offerings. This summer, we moved as I said, our summer program to entirely online. That's been a great success for us. And so I think that will become a permanent feature of the university. And so I think students are going to be able to take part, sort of consume their education in a much more flexible way than it used to be, that it'll be a more personalized education. And students, instead of being all online or all on campus, maybe a student will say, I'm going to take 2 courses on the campus and 3 courses online. And then I'm going to engage in a research project, or I'm going to work part-time, or maybe even I'm going to go overseas and take the courses I need at my university while I'm living in Barcelona or something like that. So I think this increased flexibility. And then there are a whole bunch of issues around working at universities, right? Or more as across the economy. Are we going to see more people working from home, for example? More flexible schedules for people to do their work. So I think there are going to be a lot of positives out of that as our institutions take what we've been able to learn out of this experience and apply it to become broadly more flexible and adaptable institutions.
And any of those things, I hear a lot of positives, a lot more flexibility, probably to a certain degree. Online education is here in an expanded form. But any parts of this new normal that you think will fade? You've mentioned masks. Surely masks at one point might fade, or maybe not. Any parts there that might fade away?
Well, I think the mask will fade away. And, from what we see from our students in our community, uh, people want to be on the campus. And so they see the value of that. So I'm not worried. If we're providing a high quality experience, the students, I think, are going to want to be back on the campus. That's, I think, very much what we're seeing. I think there are another set of consequences depending on how long this economic downturn lasts, what the employment prospects look like. Does that affect the choices students make and what they want to study? And how do we adapt our institutions to that while maintaining our educational philosophy? So I think some of those things may endure for a fairly long period of time, depending on the evolution of the economy. But I think overall, what again we're observing is that our students have really are much more cognizant in a way of the opportunities they have by being part of a community on campus. But I do think one of the effects you're going to see is institutions like Rice across the country, we're going to become, in some ways, bigger institutions. And I don't just mean an on-campus population, but if you look at the number of people, when we decided to lower our cost for summer education, for example, that was driven both by wanting to make an opportunity available for our own students, but also recognizing that people across the city of Houston, many of them were confined at home, high school students who might be able to take a challenging, Rice course. This gave them an opportunity that they might have not otherwise had. And so I think you're going to see that stick, and that's going to create a kind of national competition that's much more vibrant in the online space than we're used to seeing.
Yeah. So more competition, more offerings, potentially more demand, but it all depends on how long this pandemic lasts, how long the drag on the economy lasts. And what you said about summer enrollment, that's actually one of the first questions we have from our virtual online audience. You mentioned that the summer enrollment this is from Ronald. Um, you mentioned that summer enrollment was unexpectedly up. Does Rice expect significant changes in enrollment numbers for the upcoming fall and spring semesters? So do you expect that upward trend to continue into the full academic year?
Yeah, the summer issue, of course, was a little different. We had a lot of people, in effect, stuck at home. A lot of internships, jobs had disappeared, and so that was a great opportunity to expand what we're able to do during the summer. Our deposits are up for the fall, and so very strong, both undergraduate and graduate education. Again, we're concerned about our international students and hopeful they will be able to get to the campus on time. I think if we or other universities are not able to offer the full on-campus experience, we may see a number of students deciding to defer. But right now, we see very, very strong enrollments, interest in coming to Rice, and so we're optimistic about the year ahead. I think what people have found by being at home and people in very different circumstances, what home means. And we have to be very sensitive to that because the burdens of this pandemic in so many different ways do not fall equally in all populations. We know the health burdens fall very heavily on poorer communities, minority communities, but it's also true about working from home in some ways, that if you're in a very crowded household, for example, you don't have Wi-Fi, that's very challenging. And so what we expect is these students will really want to come back to campus, but it's hard to predict. Even if you look at Texas in the last 2 weeks, the situation has changed quite significantly in Texas. And so we monitor that. I monitor that every day. I wake up in the morning and look at the numbers. I go to sleep in the evening after I look at the numbers. And so we're constantly making that decision. But I said right now, deposits are up.
I'm going to go back to the audience questions in a minute, but one thing that you said reminded me of something else that I'm very curious about. You mentioned how the burdens of this pandemic has not been equal, and in some ways it's also revealed a lot of inequities in our society. And I'm wondering, what is Rice doing for first generation students or more low income students that maybe need more social support, or for whom home isn't, a safe place where they can study remotely?
So the first thing we did was allow those students to remain on campus, right? So if you had no reason to remain on campus other than you thought it'd be, fun to stay on campus, you couldn't stay on campus in the spring. But every student who would be challenged, whether it's international students or students who would have a difficult home environment to study from, were allowed to remain on campus. And some of those students are still on the Rice campus this summer, and some of them are taking summer school courses, and that'll be our basic posture going forward. Those students need support. We also provided technology help. In one case, in a rural town in Texas, we helped a student have an antenna constructed on her house so that she could get better Wi-Fi or internet, I should say, not necessarily Wi-Fi. And so we stand ready for that. And we had, for example, one of our trustees very generously donated tens of thousands of dollars so that we could support our students in their adaptability. And so I think it goes again back to, don't mean to keep repeating about it being flexible, agile, and adaptable. And a piece of that is making sure those populations are suited. The other thing are well equipped, I meant to say. The other thing I would say about that is that it's important that our student services remain in place as they did. And so we may not have had, the students may not have been on campus and our staff may not have been on campus, but all of our student services were still operating. And that's really important to the students. And some of the students we heard from, that they liked the accessibility of the services online, and they expressed a hope that actually that would continue, that they would be able to access whether it's mental health services or financial services, that they could do that in the same way we're doing this in a Zoom session, for example. But it's really important. You look at the makeup of our student population, number of Pell Grant recipients, first-gen students, low-income students, students from really high schools that don't necessarily, have the same number of advanced courses. We have a whole range of programs in for those students. And I think what we've discovered is those programs are actually really important. And it was, one of the reasons that we were eager to bring students back to campus, if we can, is because we know those students are much better supported when they can be in the supportive community of students, faculty, and staff at Rice.
That's great to hear. Thanks for sharing. I'm going to go back to our audience questions. Here's one from Baker. Is wondering, how will occupancy of student rooms in the residential colleges be affected?
So we're still in the process of taking a close look at that. There are a number of issues around that. One of the questions is, well, how many people you should have in a room and what should bathroom use look like. But there are also questions about how do we make sure that we're fully prepared to quarantine students or isolate students. We think our residential living environment will be relatively normal, and we expect, again, the students to be taking the precautions of wearing masks and keeping their social distancing. But we've reached out to the Texas Medical Center to get the best advice we could on that, and to others. And so we're in the process of making those decisions to make sure our students are in a safe environment.
We actually have a related question to that. If a student does test positive, what kind of measures will be taken in terms of isolation in residential colleges, contact tracing, etc.? Do you have any specifics you can share there?
So we are in a process of determining what our testing protocol will be, what testing at the beginning of the semester might be, and what testing over the course of the semester might be. We are going to be asking students to monitor for any symptoms and ask for folks with any symptoms whatsoever, not just fever, but any of the recognized symptoms, or frankly, even if they just feel ill, that they not come to classes, not come necessarily to the dining halls and have meals delivered to them, for example. So that's a really important part of the process that we're developing to make sure that our students are safe. So we want to make sure that we can accommodate all the students we're bringing to the campus, and then make sure we can move them into appropriate facilities for either quarantining or isolation as the semester develops.
Okay. We have a couple of questions on a different topic. Several people, I believe Jenny and Todd, both are wondering about the governor's announcement today that K-12 schools, Texas public schools, will be reopening for in-person instruction this fall. And so on that note, to what extent do the guidelines of other schools, how are those other guidelines influencing Rice's decision-making? And also, what kind of considerations are you making for teachers?
Yeah, so we pay attention to what other research universities are doing across the country. We pay careful attention to what other colleges and universities are doing in Texas, and then as I said once more, what the Centers for Disease Control is advising. There's a big difference between K through 12 and college, and I'm not in a position to make pronouncements on K through 12 education. I have no expertise there. But the big difference is, by and large, those students are going home to their families every night, and then they're coming back. And that's where a lot of the risk is, going home to their families every night, and whatever risk is in their families, which depends on what are their parents doing, where are the parents working. And I think one of the things we're going to really be telling our students is, you come to the campus, be part of our community, but we don't really want you going, flying back home and perhaps creating increased risk. That was one of the reasons we were one of the first universities to announce that we would be slightly shortening the semester to conclude by Thanksgiving. And one of the reasons for that, there are many reasons for that. One was the risk of a second wave that might come as the winter approached. But another one was the risk of sending all our students home. And if they came back from being home, that might be a situation in which they were bringing more risk back to the campus. And so that's what we're cognizant of. And so our risk, unlike sending our students home, is we have some of our students, obviously, and our faculty and staff who are off campus. And so how do we protect them? And going to the other part of your question, again, as I referred to before, if a faculty member is at risk or has a family member at risk, and they're not comfortable coming onto the campus, then they're not going to have to come onto onto the campus. And so that gives both our students and our faculty the ability to decide for themselves. The university can't decide for everybody. And so they'll have the ability to decide for themselves if they have a risk factor that they're better off not coming to the campus and teaching remotely, for example.
Yeah. Okay. Thank you for that. We have a very specific question from Cynthia. She's wondering, will facilities such as the recreational center and student-run businesses in the RMC be operational?
Yeah, I expect that they will be operational with protocols in them. So that's going to be a smaller number of people. Our exercise equipment is well spaced out. We haven't worked out all of those issues, whether people will be able to use, for example, to come and use the locker rooms. That's a separate issue from being able to use the facility. We're not there yet. That's part of what we're, and I really want to emphasize that we got through the spring semester. That was one set of issues. The level of detail, as one person on my team remarked, we thought it was difficult sort of closing the university or not completely closing, but getting students off campus and moving online. We thought that was a hard process. Nothing compared to the process of thinking, how do we ramp back up? How do we do so safely? The number of decisions, and the rec center is a good example, right? Exactly what is every protocol in the rec center, in terms of every area of the rec center, what is really safe? Can folks use the swimming pools, for example? Those are all questions that we haven't made a final decision on.
Okay. Now, this is an interesting question. We haven't touched on this at all, but I think it's really important. This is from Jen. How should universities prepare for mental health needs and also other support services that students will need this fall?
That's a great question, and it's a very important question. We know, one, that these situations induce a lot of stress, and again, that stress is not equally distributed. Students from low-income first-gen families are going to experience more of that stress, and so we have to make sure that we have the mental health staff and facilities available, and I think we do. And I think, and some of that, of course, I think will, as I said before, be delivered online. But really, again, that goes to bringing the students back also, that we know it's not just the mental health professionals who are vital to our community, but also the supportive friends who are around that people can console with and communicate with, and roommates, for example, who are part of their lives. Faculty and staff members they rely on for advice and friendship. And so all of that is part of a network of support that I think is really vitally important to the community. And even while we're planning to be back on campus, we're also looking about the questions. How do we provide all of those services and that support better? How do we create a community if we have to be online again? How do we create a better online community? How do we make sure people are comfortable accessing all of the services we have and they feel welcome doing that? And so those are part of the questions that we're addressing. It's not just one plan going forward, right? There's a plan A and a plan B and a plan C as we think about if different things happen over the course of the summer or beyond, how will we respond to those?
Yeah. And specifically on the mental health, do you imagine hiring more counselors?
It's an issue we'll have to look into. I think we have to be dynamic about it. I think we also have to be, careful. You don't want to hire a lot more people and not necessarily have the demand for them. And again, we have the fortune of being across the street from the world's largest medical center with great services across not only the sort of the surgery and physical health, but also the mental health services. And that's something we'll want to be prepared for to deal with the stress of the students. But again, a lot of the stress, some of the stress and aspects of that need mental health professionals, but a lot of it really needs the staff that we do have on campus, and not just the mental health staff, but the magisters of our residential colleges, the residential associates in the colleges. All of those play a really vital role in the life and health and safety of our students.
All right, we're getting close. We're not there yet. We still have some time, but we are getting a lot of questions. So I'm going to try and get as many in as possible. A real quick one from Grace. Will all on-campus events be closed to outside guests?
Not necessarily. I think we want to look at our plan is not to close the campus in the fall, and of course, folks still come onto the campus. I think it depends a lot on the events, and they may be events that we want to prioritize for our own community and our own students. But if the folks coming onto our campus, for example, a concert with a limited audience, if we're able to do that in the fall, but we'll expect them to adhere to the same rules that apply to members of our community. And that will mean wearing masks and keeping the right physical distance between others.
Okay, here's another question from Ron. Can you share one or two stories that for you serve as the defining moments for life at Rice during the pandemic so far? One or two defining moments
One or two defining
that you would write in your autobiography.
I have no plans to write an autobiography. I don't know if this counts as a defining moment, but one of the things I was able to do, which I can't do as much, is I sat in on about 25 classes. Not the whole classes, but on the Zoom classes, I went to the classes, sat in on a one-on-one violin class and saw how folks adapted, and sat in on a student taught class on, I think it was on digital origami of all things. And so I think that experience was pretty defining for me to see our students and our faculty really dedicated to the mission at hand, and to see the creativity. One of our faculties who teaches a lab course, and it's difficult to do the lab online. He put together lab kits, and sent them to every student in his class. That to me is the defining moments for me, are the moments when you see people rise to the challenge and show in their actions the importance of us being the community of Rice University. And I got a little glimpse of that by being able to sit in on these classes and for a moment at least be part of the community of those classrooms. That was probably the most memorable thing for me out of this experience.
Well, maybe you can sit in on some of the online classes, if not in person. And that actually is related to another question here. I'm going to try and find it in the list. How is Rice, this is from Paul, how is Rice University addressing concerns about the quality of instruction in an exclusively online or hybrid model? How are you keeping up the quality of education at Rice?
So, in the spring, we had essentially 2 weeks to move 1,900 classes online. And we had really outstanding staff for that, because we already were delivering a lot of online classes and a couple online degrees. And so we were able to do that, I would say, fairly well. But that's not to say that we can't do it better. And so one of the things now is more technology training for faculty, more provision of assistance, probably providing undergraduates and others who are technologically adept to assist people in the process in the classroom, and providing training over the summer, and asking people to be imaginative and to really engage not just in the classroom aspect, but what are the other aspects of outreach? Again, how do we create this fuller sense of community as we engage in online learning? And some of that's through, for example, social media plays a role. We mostly use Zoom in the classroom setting. That has a lot of different capabilities that we can take advantage of. But I think the advantage of the summer is really the faculty now have the time to think more carefully about how to construct their online classes, and to take advantage of the training that we offer to each and every faculty member.
This goes back to something we talked about earlier about sort of the international connections for Rice University. Kenya is asking, would it be possible to create partnerships with other universities overseas to educate international students, labs, etc., in their local facilities, teaming up with professors at both ends while they're doing online ed? So I guess maybe to sum up, do you see more opportunities for international collaborations during this pandemic?
Yes, that's a really great question. I'm kind of smiling because that's a conversation we've started having, and so uh, again, thinking about not just what the burdens of the present situation are, but what are some of the opportunities? Can we create more classes in which you have students from around the globe, which is to some extent happening in our summer school classes? Can we use that to enhance or build new international partnerships? So we're beginning to think about those issues and taking advantage of them. And as we think about building relationships, we can have a relationship which is both a kind of physical relationship where we have faculty and students going back and forth when that's possible, but we can also have people sitting in a class together as they do on the campus. And that's really part of our philosophy, part of the importance of having a diverse student body along every dimension, part of the importance of having an international student body. We expect our students to get an international education, whether they're studying overseas or they're studying at Rice in some sense. And so I think the questioner was really very perceptive. That's really a great question, and we expect to be exploring those opportunities.
Okay, so maybe stay tuned, more to come on that. David has an interesting question. Rice being a research institution, what kind of COVID related research is being done at Rice?
So a lot of COVID related research. One of the things, of course, that got the most attention was the invention and design of a ventilator that would cost less than $300 at a point in this where folks were really very concerned there wouldn't be enough ventilators, and ventilators cost, I think, it's like $10,000 or more. So this is something that would be really great if we needed them in the United States, but also something that can be used as this disease has spread around the world into poorer regions of the world, in Africa and South America. I think it's important that we be able to contribute to that. And then we have epidemiologists and people studying the biology of the disease, but it's also really important that we understand some of the social aspects of this, and some of the even humanitarian aspects. We need to understand this from every dimension. How does this affect different populations? What are our ethical obligations, for example? And so we announced that we had created a fund from Rice Resources of $500,000, and we're seeking to raise another $500,000 for COVID-19 related research. And again, that's understanding what the impacts, for example, in the different communities in Houston might be. It's really important that we understand that and understand how our failure to deliver better healthcare and reduce stress in various environments, some of the underlying factors that exacerbate these disease, again, like diabetes or hypertension, are very unequally distributed across our populations. We have great people at Rice who work in the area of health disparities. And so we have research projects we funded across all of those parts of the university that can contribute not only to addressing the present pandemic, but really addressing long-term underlying issues should we face at some point in the future another challenge like this.
Okay. Well, before we go, just going to slip in a couple more rapid fire, perhaps. Do you think standardized testing should be removed for admission consideration for future students? That's one from Amy. Another one is, how is the Rice Health Services ready for COVID-19 cases? And one more question about, do you see the economic environment lowering the standard of admission at all?
So let me maybe start with the first and the third. We've announced essentially going test optional for next year. And that's really a recognition that, we don't want to impose any health risks that are unnecessary on our students. And so generally we see value in testing, and we're always looking at what our criteria. We have a holistic admissions process. A standardized test isn't the end all of the admissions process, but it helps us know where the student might be able to succeed and where they'd face greater challenges, where a student in a high school that didn't necessarily offer AP courses that would help us judge the capability of doing the load at Rice, how well they're prepared, for example, for the science and engineering courses at Rice. So that requires, I think, the testing question requires a very careful look, which we're constantly engaged in, but we've really made a decision only for next year. We generally have found the testing does provide some good information, good prediction. The testing also actually enables us to reach out to people, reach out to people who might not be thinking of a school of Rice's competitiveness. And so when we get test results, we can find those talented students all across the country and communicate, many of them in rural schools, for example, or inner city schools. So it's a very complex issue. I think, we had this year, I think, over 23,000 applicants for 950 so places. And so our students really are extraordinary. They inspire us. They're just amazingly talented. We don't see any change in that right now, given the demand for a Rice education. And the big change we made a couple of years ago in our financial aid program by providing really no tuition for families earning less than $130,000 a year really has had a big impact on interest in Rice and affordability in Rice. So we think that's going to remain strongly in demand. And I think the other question was about making sure our health officials are ready.
Yes.
There's just, I would say, not time to answer that in detail, but we are engaged all across Rice in every aspect of in some ways, rethinking the university, of how do we need to be prepared for this. And again, with that framework of flexible, agile, and adaptable, how do we make sure that we can support all of the students on our campus, an extraordinarily diverse group of students from different experiences and different backgrounds. And that's not just the health services and the mental health services, it's career advising and it's academic advising. It's making sure we have the right bridge programs for the students who may not come from high schools that offered all the advantages of some of the students from more privileged environments. And so that's a process that's underway at Rice University, and I dare say around the country. And that's why it's so hard. It requires that we think about more or less every aspect of what we're doing as a university. And I'm hopeful that out of that, we will emerge from this. We will emerge from this better. And even after the pandemic, we will be better. And our communities will be better and we'll serve our communities better. And so that's what keeps me going. This is a challenging time for all of us, our students, faculty, and staff. We're excited about the return in the fall. We hope that'll be possible.
Yeah. Well, it's nice to end on a positive note that perhaps with all this rethinking and research and coming together, that maybe we will be better off on the other side of it. President Lebron, I want to thank you so much for sharing all of this insight and plans with Asia Society and the audience tonight. Thank you, everyone, for joining us this evening. Please tune in again next Thursday, that's June 25th at 6:30 p.m. Central for Asia Society's Women's Leadership Series. The topic is Stepping Up and Giving Back, uplifting stories of women responding to COVID-19. So all across the country, people are finding innovative ways to serve frontline medical workers, employees who have been laid off, and in general, support vulnerable community members in need. And in many cases, women are leading the way. This sounds fascinating. Join Asia Society as they welcome some of the most creative and hardworking women in the food industry who have found people-centric ways to serve the community during this challenging time. That's coming up again next week on June 25th, and you can learn more about that and other upcoming webcasts through the Asia Society website. That's it for tonight, and thank you so much.
Thank you, Laura.
Thank you.